Welcome to HITea with Grace, where we spill the tea on HITea. I'm thrilled to be at 2024 today, speaking with the industry's greatest leaders about the industry's greatest problems and the solutions that are solving those problems. I'll also be learning about leadership strategies that keep these leaders at the top of their game. All right, tee up.
Hi, I'm Lisa Bari. I'm the CEO of Civitas Networks for Health. I'm also a co-host of the HealthTech talk show.
Thank you so much for joining me today. So tell me a little bit about what you feel to be the industry's greatest challenge.
Yeah, I think health tech in general really has a major problem with sort of the reliability, the reproducibility of results, really showing that health tech and digital health can really be used in clinical settings, in a variety of different clinical settings with success. Some companies have really invested in their research, in outcomes, in proving out what they do, but not everybody has. And now we're kind of getting to the point where it matters what you could actually do to drive better outcomes, reduce cost, better integrate technology into clinical care.
Interesting. I'd also love to learn more about what innovations are solving those challenges.
Yeah, I think that health tech is starting to figure out that we need to do more outcomes research. That's starting to happen. So there's some innovation in getting clinical research broadly to include more people. That's always been a constant problem in clinical research broadly, not just in health tech. So that's starting to happen slowly but surely. I also think that interoperability is becoming a bigger issue. So people are saying, okay, I have this clinical health tech application or this tool or med tech or whatever it is, and I need to figure out how to actually get the data into our system, into our clinical workflows, and out of our system and out of our clinical workflows. And so there are some opportunities that are coming forward at this point around interoperability and exchange. And so I think we'll see how that plays out in the next couple of years.
Now, moving on to the personal side. What advice do you wish you could give your younger self?
Yeah, I got into health policy, through health tech, through digital health, and I just wish I had gotten into policy earlier. I really think it's important for health tech innovators to understand how policy and regulation and all of those things work together. Pretty early on, when you are starting and growing a health tech or digital health company, you should really start to invest and understand the regulatory landscape. And so I would just say, do that sooner. And I would have done that sooner in my career in health tech.
Thank you so much for joining us today. We loved learning from you. And thanks to you for joining us too. Check out the HITea with Grace podcast website and YouTube page for more great guests like the one today. Cheers.